So the hospital at home program is really just a little bit higher level of care in the home. We will come out and see you daily, sometimes more than that if it's necessary. It's for to help treat an acute condition in the home, whether that be COVID-19, COPD exacerbation, CHF exacerbation, an acute infection. All of those things we can safely handle in the home. Patients just in general tend to do better in their home. There's not a nurse coming in every hour on the hour to grab a blood pressure or whatever it may be. So patients tend to sleep better in the home. They feel better in the home. They eat better because it's their own food usually. And then they can be around family. They can have their caregiver or whoever it may be there available in the home with them. Just being in your own environment can sometimes help the healing process and help you feel better faster. We actually ended up helping her get placement in a rehab again for a second time, so she could get stronger and be more appropriate to be at home.
Yeah, the ambulance drivers might call the ambulance to come get me because they thought I should go, and so the ambulance drivers told me they wanted to give me some information. I said, sure, and the advice. So he said, do not go to the hospital. He said, not that they won't take as good a care of you as they can, but you can get better care right here than you can get at the hospital because they are so loaded with patients.
Yeah.
So it was really nice, and my son was able to stay with me because that once they left, I still had to have somebody at night with me, so my son stayed with me, so it really made it nice. They took good care of me. I mean, excellent care of me. I can't complain. Another thing is, it's not just them coming to see you one time a day. It's 24 hours. If you need somebody at night, which I did. I called it a meltdown one night. My son, he called over there and told them. So Ashton came.
Mm-hmm.
She was there, and it's like 10 or 11 o'clock at night, and so she came over and talked to me, and she said, you're well now. She said, don't worry about it now, you're well now. So that really meant a lot to Mike and me to have her come at night like that. Another thing is, like if you have a problem, say she comes today or tomorrow, you get up and your blood pressure is sky high, well, you call them and you tell them what's going on. You don't want, they want you to call and tell them and let them know what's going on. And then they'll either send somebody out, they'll check on it, we'll take care of it. Because that's one big thing with me. I'm by myself. I don't see anybody Sunday and Monday. Now Tuesday I see my son. Wednesday and Thursday I don't see anybody except the nurse comes on Tuesday now. So and they are so sweet. And it's then when they get ready to leave, they say, is there anything else we can do for you? So that means a lot. And I hate to say this, but I even had them checked. I had some Drano and stuff on the sink one day. So I said, now which one of these goes in the commode and which one goes in the sink? So she even stopped and told me that. We marked it so we could do that. So it's not, they'll do stuff like that for you. Yeah. But every one of them has been wonderful, and sometimes you can get a hug.
Mm-hmm.
I do cooking. I still am able to take care of my own house and do that too. So I'm pretty well able to do everything. It takes me just a little bit longer, but I still do everything I ever did. I would say it's the best program I've ever seen. They're all wonderful and just great. And I would like to see. In fact, hopefully I sent you a new patient last week, because every time we talk to someone, I say, you want to go to Healing Hands, now that's who you want to get. So I do talk about y'all all the time and tell how good you are. I just say that if you need home health, that Healing Hands is the best there is. They also offer therapy, and they have a good therapist team, and I've used them both, so I'm speaking from experience that I've used the nursing and that. But it's number one plus, I tell you. That's why I'd grade them as far as helping. I went to my daughter's because I couldn't get up out of a chair. I couldn't get up off of a commode. I couldn't do anything. So the therapist came, and first thing he said, what you're going to do, get up out of that chair 30 times today. And I said, oh my goodness gracious, I'll never do that. But I did. He put a belt around me, and then when I would get so far up, then he'd give me a little push, and then I could go ahead and get up the rest of the way. So I did do the 30 times, and then I walked some for him. So with that, and then the next week, then I had another therapist that came from Bridgeport, and I did the same thing. I got up in the chair. So after that, I was able to get up out of the chair by myself and get up off the commode. So it really helped, I tell you. It really, and they were really good.
The biggest thing is we were seeing her so often and so frequently that we were able to notice just the smallest change, and we were able to notify the right physicians and immediately get treatment and intervention so that we could change the course, basically, because we were starting to go downhill, but we got the right stuff on board at the right time, and we were able to turn things around and do a lot better.
You saved my life.
I don't know about that.
Yes, you did. Lifesavers.